With today's society, image is everything. Society thinks people need to look a certain way. Because of this, eating disorders are being taken to an extreme level. The most common types of eating disorders are bulimia and anorexia. According to Melissa Conrad, bulimia is a series of episodes of secretive, excessive eating, also known as binging, followed by inappropriate methods of weight control. Anorexia is excessive dieting along with restrictive eating to none at all. My dad was diagnosed with bulimia his junior year of high school. As a child, he was overweight and fatigued from how he looked. Entering junior high and high school made him want to change his appearance, his way changing his life forever. My dad started throwing up so often his throat was extremely damaged. He was hospitalized twice and underwent treatment to get his health stable again. What he did not do and should have done is talk to someone or diet in a healthy way. Because he had bulimia, he now has problems like simply brushing his teeth every morning because of his gag reflexes are messed up from having grown up so much. Bulimia and anorexia are serious matters that need to be accounted for. People do not always see what is happening to a person, but if they knew the right signs, people with bulimia and anorexia could get the help they need before their choices harm their body. With knowing the signs, diagnosis, health issues, and treatment of bulimia and anorexia, people can see the similarities which can in return help a person with either disorder. What many people do not realize is that many bulimics and anorexics go unnoticed until damage has already been done. With that being said, bulimia and anorexia have multiple signs to tell whether a person could be diagnosed with either of the eating disorders. These signs are not the diagnosis itself, but triggers that should be taken more seriously in case a person does have an eating disorder. Melissa Conrad states that the first major sign is when a person goes to the bathroom after every meal. The person does this to induce vomiting or after the use of laxatives. This is what starts the majority of the damage caused by bulimia and also a sign that gets brushed under the rug. From vomiting comes physical signs like swollen jaws or cheeks, bloodshot eyes, or damaged teeth due to lack of immunity. Little signs like this go unnoticed or pushed aside, but could end up saving a person's life if seen earlier. According to the Avalon Hills Residential Eating Disorder Program, another sign to tell if a person has bulimia or anorexia is when a person vigorously exercises. This is another way for a person to gain control of their body and try to lose the weight along with binging. A person who obsesses about their weight constantly could also have bulimia or anorexia, if other signs listed above are present. Most people dieting normally do not obsess over their weight like someone with bulimia or anorexia. On the other hand, bulimia and anorexia have signs different from each other, only specific to one or the other. Most bulimics keep normal weight unless excessiveness of weight loss is taken to an extreme. Some bulimics experience weight fluctuations depending on how often they binge or fast. However, for most cases, they maintain a steady weight. On the contrary, people with anorexia usually become thin to an unhealthy level. Melinda Smith states most anorexics will have a severely strict diet, banning bad foods. With a strict diet, people with anorexia will fantasize about food or become obsessed with it. Some obsessions are cutting food into tiny pieces, collecting recipes, or hoarding. Anorexics will also look dead or ghostly as they experience a lack of nutrients. With a decrease of food nutrients, anorexics can become irritable, depressed, or tired easily. Nutrients in food are crucial in a person's health, and without them, a person cannot function correctly. Bulimics are the exact opposite, as they will secretly eat large amounts of food at one time. They do not care about the calories, however, they will later feel guilty and vomit, exercise, or use laxatives to get rid of what they just ate. Anorexics will differ in the fact that they try to hide their weight more than bulimics. They will deny anyone who says they are too skinny. With the denial, they will wear baggy clothes to hide their weight loss and cover up what they think is fat. While bulimia and anorexia have similar and different signs, all are important. Once signs have been addressed, a final diagnosis can be given to fully confirm that a person is bulimic or anorexic. A doctor has a set criteria for each eating disorder to determine the final result. Bulimia and anorexia have two criteria that are similar. The first criteria is the excessiveness to not gain weight. This could be done by vomiting, laxatives, exercising, or other medicines to prevent weight gain or speed up weight loss. This is what makes them an eating disorder. The second criteria is the fact that both bulimics and anorexics are dissatisfied with their path of bulimia or anorexia. Stated in an article on medicinenet.com, due to the fact that disorders are separate from each other, they have differences in their diagnosis criteria. For bulimia, 5 basic criteria must be met. However, anorexia only has 4. The first criteria distinct for bulimia is vomiting after eating. A person must eat an excessive amount of food, followed by throwing it up. The second criteria is the feeling to not stop eating. As one eats, they start to feel better about themselves. Then after, they feel disappointed and throw up. The third difference for bulimia is all 5 criteria must have occurred for 3 months, and binge eating must be done at least 2 times per day. If all criteria above is positive, then a person will be diagnosed with bulimia. With anorexia, some specific criteria must be met also. The first criteria is to have an extremely low and healthy weight. This is from not eating at all or being on a specific diet. The second different criteria is having the image in one's head that they are overweight, even when they are extremely underweight. Finally, the third criteria is having this period or periods that come after medicine has been given. Each of these criteria are critical for a doctor to determine the diagnosis. If signs go unnoticed and a diagnosis is not made, then people with bulimia or anorexia are at an increase in major health issues. Similarly, bulimia and anorexia can cause depression along with fatigue. In the article, Anorexia Nervosa versus Bulimia Nervosa, people with bulimia or anorexia could also experience dry skin. A little more serious health issue is a person can acquire an irregular heart rate, which could possibly lead to heart failure. A person suffering from bulimia or anorexia is at great risk for having electrolyte imbalance from the use of laxatives. This imbalance could result in life-threatening consequences or more serious problems. More so in anorexia than bulimia, mortality is the most serious health issue either disorder can have. Nevertheless, with their similarities, bulimia and anorexia also have different health issues. Contrary to anorexia, bulimia's health risks deal more along the lines of the throat, esophagus, and stomach. This is because of the binging and purging that creates the varied effects on different body systems. The self-induced vomiting creates acidic gastric contents that erodes the teeth. The gastric acid also harms the esophagus by creating ulcers. In contrast, anorexia affects all different organs in the body. From the heart, kidneys, to bone loss, a lot of damage gets done. Anorexia can result in increased or decreased urination or fatal potassium deficiency. Another significant difference between anorexia and bulimia health issues is anorexia experiences significant bone density loss. This creates a greater risk for fractures later on in life. Even though bulimics and anorexics are at risk for many health issues, with the right treatment and attention, they can be overcome. Treatment for anorexia and bulimia is very similar to each other. Each is considered a psychological disorder. Because of this, group therapy or support groups are strongly advised. If health issues are present, outpatient treatment can be given. If there are more serious issues, then hospitalization may be needed. Anorexics may go into hospitalization to gain weight back, while bulimics will go to seek medical attention for the damage done to the acidic gas from vomiting. Similarly, antidepressants are also given to people suffering from bulimia and anorexia. This helps so they are more willing to be in a healthy state of mind to gain their health back. The most important part of the treatment is for the person to lead an emotionally and physically healthy life. With medical and emotional health, bulimic and anorexic patients can gain control of their body and life back. With knowing the science, diagnosis, health issues, and treatment of bulimia and anorexia, people can see the similarities and differences, which can in return help a person with either disorder. Bulimia and anorexia are serious matters that people need to be aware of. People do not always see what is happening to a person, but if they knew the right signs, people with bulimia and anorexia could get the help they need before too much damage has already been done. Society has put an image out of how people should look, and it is not right. People should be able to look however they want and not be judged by people. There are already many people suffering from bulimia and anorexia, but it is never too late to help. With the right awareness, people can help identify people with either disorder and show them that they can overcome both